Dear members, you may have heard by now that as of 1 July, your award has expired and the government has flatly refused to extend the successful ratio system to more nursing specialties, as well as refusing to improve and extend ratios in our country hospitals. There is still a dire need for nurse-to-patient ratios in country hospitals and specialty areas like EDs, paediatrics, neonatal intensive care, critical care, and community, that if there was any merit, then nurses and midwives would have to pay for improving patient safety out of their own pay packet, because that's what the government's law imposes. Politicians have accused the association of running a misleading campaign. But if they actually took a few minutes to talk to nurses from their electorates, they would realise that our claim was developed after consultation with nurses and midwives across the state and carefully tailored for the nursing care needs of your patients. Unlike the behaviour of your employer, the current state government, the association is a democratic organisation that believes very strongly in consultation with members to ensure that our working conditions uphold the type of safe patient care you want to deliver. These past few months, the O'Farrell government has chosen to take on a more dictatorial approach. Without consulting any of the involved parties, they have arrogantly overruled a decision of the full bench of the Industrial Commission, which upheld the previously promised 2.5% pay increase for public sector workers. And how did the government do that? By changing the law again. So now you pay for the increase in superannuation legislated by the federal government out of your own pay increase. Further, they are moving to make a new award using the Industrial Commission, of course when it suits them, without even having engaged in any negotiation on your ratios claims. The actions of this state government and their complete disregard for the important work that all public sector workers, including nurses and midwives, do, has forced your association's elected representatives to make the difficult and serious recommendation to take strike action. On Tuesday, 16 July, a special conference of your delegates from across New South Wales met to consider what was necessary to take the next step in our campaign of putting patient safety first. The overwhelming decision of the delegates and Association Council was to recommend strike action. We need to demonstrate to this arrogant state government your determination to deliver safer patient care for all our patients in the health system, and the need to extend and improve nurse-to-patient ratios to deliver that safer patient care, not just those that benefit from ratios in our large city hospitals. Your delegates voted overwhelmingly in favour of taking strike action. You've told us that nursing ratios work when the numbers are right. But for all of those that don't currently have ratios or whose ratios are inadequate, we hear loudly and clearly that you have had enough. You have had enough of having to make do with dangerously low staffing levels. Enough of being unable to take breaks or even sick leave for fear of not being replaced. Enough of having to make the difficult daily decisions about what patient care to omit because there just aren't enough of you to go around. Yes, we do the best we can for our patients, but it's time to show this government that enough is enough and that patients deserve a safer level of care. To deliver that, we need guaranteed nurse-to-patient ratios. We need those guaranteed nursing numbers in our country hospitals, EDs, community health, paediatric wards and critical care areas. Your delegates and elected members of the Association Council have carefully considered the options left open to us in this campaign. We have concluded that we need to send the strongest message now to the O'Farrell government that we believe our patients deserve better. This strike is now unavoidable because of the government's refusal to negotiate. I ask you to join us on 24 July at Sydney Olympic Park with thousands of your fellow nurses and midwives across the state to take strike action and stand up for safe patient care. We will also be webcasting the event live to 17 regional sites. More information about the details of the campaign will be made available to you via email, SMS text, and on our website and social media sites. Please make sure to check your emails and phones. If we don't have your current contact information, you can now update your details on the website via our new membership online portal. The Association is prepared to talk to the government about real solutions for safer patient care, but its response so far is legal action and intimidation to try and stop your voices from being heard. If you are one of the many association members who have already participated in this campaign, your actions have not gone unnoticed by both politicians and your local community where support is building. We ask for your continued support for our patients and our profession. If you're new to this campaign and the strike will be your first form of direct involvement, this is your opportunity to show the government that you're serious in your support for extending the successful ratio system to more nursing specialties, country patients getting guaranteed equal nursing care, bringing back your rights at work to genuine award bargaining. Remember, without showing this government that we mean business by taking strike action on 24 July, patient safety will continue to be compromised. Join us at Sydney Olympic Sports Centre on Wednesday, 24 July from 11 a.m. to 1 p.m. or at one of the 17 regional sites where the event will be webcast.